of the largest challenges that we're facing as a nation right now is beating back a health care plan that the current administration wants to force on the American people. You've heard it referred to a lot of ways. You've heard a lot of the features discussed. But the fact of the matter is that we have an administration and we have a majority of Democrats in both the House of Representatives and in the Senate that appear poised to impose on us a health care plan that we just don't want. Isn't it remarkable that in doing this, they criticize the health care that we have in the United States, when the fact of the matter is we have one of the finest health care systems in the entire world? When Silvio Berlusconi, the Prime Minister, the head of state of Italy, needed surgery, he didn't go to the state-run health care system in Italy. He didn't go to England and its health care system. He didn't go to Canada. He came to the United States of America. When Melinda Stronach, a Minister of Parliament in Canada, needed breast cancer surgery, she didn't go to that Canadian health care system. She came to the United States. And in fact, 1 in 3 Canadian physicians refers a patient to the United States for treatment every year. Why is that so? It's so because we do have one of the finest health care systems in the world. And now the administration is talking about imposing on us a health care system that they're estimating will cost about $1 trillion. About $1 trillion. It's interesting that they're so willing to estimate that cost when we're in fact very bad at estimating federal health program costs. In 1965, when Medicare Part A was put in effect, we estimated that 25 years later, it would cost us about $9 billion. Well, when that 25 years went by, that $9 billion turned into $67 billion. We missed it by more than a factor of 7. When Medicaid subsidies for hospitals were discussed in 1987, we estimated that they would cost 5 years later about $100 million. When those 5 years passed, only 5 years, in 1992, that $100 million turned into $11 billion. We missed it by over a factor of 100. The fact of the matter is that this administration can in no way assure us that that $1 trillion estimate that's on the table right now will not turn into something like $10 trillion or even $100 trillion. Now that's just one aspect of this discussion we need to have. Another very important aspect is what it is doing to providing health care in America to put on a federal health care program. The fact of the matter is, I don't want the same people that have bankrupted the Social Security program growing an enormous federal bureaucracy to provide health care for us citizens. We don't want it. Isn't it interesting that the #1 employer in the world is the People's Liberation Army of China? Number 2 is the Indian Railroad. The #3 employer in terms of number of employees in the entire world is the British healthcare system. And it's not because they have a lot of healthcare professionals. It's because they have government bureaucrats, much like the Obama administration wants to put in place to manage our healthcare. Now, there are a lot of things we can do. We can encourage and promote the construction of more neighborhood clinics to bring down the cost of healthcare. We can pursue genuine tort reform in the Congress. But unfortunately, trial lawyers make very generous donations to politicians, and that's probably why we don't have tort reform today. We can do smart things like allowing cross-state licensure of health professionals. Right now, a commercial driver's license entitles a commercial truck driver to drive in any state of the union. But if a medical doctor moves from Arkansas to a neighboring state, they have to get relicensed. That makes no sense to me. We can also shift the burden off of medical doctors, MDs, and allow LPNs, licensed practical nurses, and registered nurses, and physician assistants, and other therapists to take some of that burden off the physicians so that their talents can be used more effectively. We can allow healthcare insurance companies to reward good behavior by lowering premiums now, as in many cases statutes limit. That makes no sense to me. If people are living healthy lifestyles, they should be allowed to pay less for their insurance. There are a lot of things in the 1,000-page plus bill that the Congress is considering right now. Those things need to be taken out. There are probably some smart things we can do, but I'll tell you that the dumbest thing we can do is turn our federal health care system over to the federal government. And I have committed to fighting this if I'm put in office and given your trust. And I'm committed to reversing anything that's put in place if you put me in office. Let's fix health care. Let's not turn it over to the government.